Well, I want to welcome everybody. We want to have a frank discussion about being back and what it means, and being back means different things and in different areas, and even in Cherry Tree School District, it means different things. It means different things for elementary school students, different things for high school students, different things for parents that want to start out online. So it really means all those things. And Commissioner Anthis, Superintendent, the Teachers Union, these are unprecedented times. I don't think, nobody signed up to be a teacher or a superintendent or a commissioner or a governor thinking that there'd be a global pandemic. And really at all levels, I just want to compliment everybody for really handling this in the best way that you can given the circumstances. And nothing in our state, in the world, is perfectly safe right now, right? And there's people that work in grocery stores every day. There's still cops out on the street. As governor, I have to do public events, but we're doing them in a different way, right? Like even this meeting, look at this. We're wearing masks, we're 6 feet apart, and if one of us is contagious, hopefully no one else will get it the next day. And that's what we're learning to do in our schools. We're learning to do the cohorting. So when there is a kid or two that come down with the coronavirus, that it doesn't mean the whole school needs to close, right? Because we hope that it's just an outbreak in that classroom, and we hope that they can handle it, and 2 weeks later they can go back and they can learn online, and that it's not easy to figure this out. And so I want to thank the collaborative relationship, and there's tough questions too, and I'll start by giving a tough question to the superintendent because he's accustomed to those. And I'll answer it too after you answer it. So we try. You try. I think the teacher, the principal, we all try. You try to listen to everybody, of course, but inevitably, it can't be the exact plan that everybody wants. So you have folks who say, how dare you're only back 2 days? I'm a single working parent. My kid's in 8th grade. What do you want me to do? Why are you making me go back? I've taught for the district for 20 years, and I have been staying home, and I'm avoiding risk, and I'm a careful person, and you're saying I got to show up to a classroom, and I know I'll be wearing a mask, but it's a lot more safe if I stay at home. So while you listen to all those voices on all sides, what do you say to people who don't agree with the exact course that you're taking, and how do you respond to that from any side?
Thank you. First, let me start by just thanking you, because you can't have school without a safe community. Yeah. And you said it earlier, you have taken action in Colorado to allow us to contemplate having schools. And then we took the guidance from our health departments, Dr. Douglas at Tri-County Health and the CDPHE. We followed, we met and exceeded every health guidance that was given to us. And that's our job, to follow health guidance. And then developed a metric-based approach database, because there was a lot of pressure. There are emails every day of, to your point, don't you dare, how dare you, don't do it full. And the job was to do it right, in the right way, for the right reason. And that's the approach we took in Cherry Creek. Follow the health guidance, give choice. We have 10,500 students 100% online, and then other students that wanted to be here, we fully implemented the health guidance that we were provided by our experts.
Great. And let me ask the teachers, it's a tough time for teachers. It's a tough time for everybody, right? Especially people who have to go in person to work. People that can work from home in an office environment can do that. But if you work in retail, if you work with customers, real estate, all these jobs, they're all taking on risk, and it's a lot to ask of teachers. And I know that, you have teachers that are excited to be in the classroom, and you have teachers that are worried, very worried to go back. And you have teachers that are both. I think most teachers are both. They're excited to go and worried to go. What do you say about how a district can work with its teachers, with the union, to make sure that teachers are reasonably safe and have the protections they need, and be able to have that safety at the same time that they know the work they do is so important? Every teacher knows the work they do is so important.
Right. So what I'll tell you is what was instrumental is that we were involved from the beginning. As soon as we went remote and shut down, we started having conversations about what this might look like. We worked through the summer with the district and asked for some particular protections, masks before they were mandated. We asked for cohorts and hybrid, and we did a lot of that. And I've heard from members who are very upset and not happy, but I've also heard from those people that are just thrilled that they're going to get some time with their kids to build that relationship that's so important for teachers and students. So, it's a balancing act. And I was just recently elected into this position, and I've come to realize very quickly I'm not going to make everybody happy, but I'm going to do the best that I can. And ultimately, it was about keeping teachers as safe as they could so students could get what they need.
And the students getting what they need is just so important. I mean, it was just, you can imagine how, Nancy Todd, Jeff Bridges, known me for many years, the commissioner, they know my commitment to education. You know how heartbreaking it was for us to order the schools closed in March, and it just was devastating. We had to do it. We had to do it. We broke the trajectory. Obviously the virus is still with us and will be with us probably forever. But it's at a level where we're learning how to do things in safe ways, and we know we can't sacrifice, the kids' education. And I want to ask the principal, it's hard to be, we use the word flexibility easily. We say be flexible. It's hard to be flexible. I mean, how do you do it when you know that one class might need to be online for 2 weeks, and in December, the school might need to change format for 2 weeks or a month? I mean, how do you even contemplate making sure the kids have the academic and social continuity, knowing that any of these, dozen possible things could happen depending on where the world is?
Well, I think for us, we always think about centering our students first and making sure that they're at the core of everything that we do. But I think that also we have that flexibility because we have amazing guidance from our district and from you as a governor. And so with that, guidance that we have, we can be incredibly flexible. We know that if a school has to shut down, or if a classroom has to shut down, that we're still, honoring our students and making sure that they're safe. But if it's a class, if it is, one teacher that needs to go home, we're still providing the best education for our students that we can.
And let me ask the superintendent, maybe talk about some of those contingencies you planned. I mean, that lots of things can happen, and you're starting out a certain way, but maybe talk about some of the different plans you've made depending on, where we are and when things happen, and kind of your different options for the future.
Exactly that. Planning for every contingency. So we start in person, except for the 10,000 that chose 100% online for the year. Then we're planning for when that day comes if we need to go remote. So the kids that need them have computers, they have high-speed internet access, everything so the learning can continue. But how important it is to be able to sit here and develop a relationship with a human before that day might come. And that's critical to kids and their development, so we don't have that lost generation that you speak of. And so that's why it's important to start this way, but be planned, because this is going to be a long year ahead of us. And we're going to take every step we need to make sure people are first and foremost safe, and then they're educated, their mental health is addressed, and their health is addressed as well.
And Commissioner Anthus has just done an amazing job. Again, nobody thought we'd ever be in this situation, but trying to find ways of working with the state board, they could, make sure they focus on the health side and get rid of all the normal requirements are written around assuming they're in seats in schools in a normal way. Now, in normal times, that's, pretty automatic, and it's how it works. This year has been extraordinary. So just looking at the flexibility, the waivers, kind of all the ways that the Department of Education has worked on online education and hybrid education, and maybe you can just talk a little bit about how the state has responded by helping to give the superintendents more flexibility about how to make it all work.
Well, thank you, Governor, and thank you, Superintendent, for having us, and Principal and everyone. It's wonderful to be here and see some of the guidance and state work in action on the ground. And I think the Governor said it well. We just, at the Department of Education, we wanted to clear the path, for these enormous changes that need to happen, and clear a path in a way that we're giving support and tools and resources, but also get rid of any, bureaucratic pieces that maybe are not the thing we should be focused on right this minute. So really wanting to make sure that there were these flexible options, different ways to count attendance, different ways to, look at what your full educational programming looks like, so that you can include remote and online, and even in some cases across Colorado, if they don't have access to online, paper-based packets that have to go home with families. And so, it's just been wonderful to see it in action here today. And so I really want to thank our educators and our superintendents and our local public health officials that are working day and night all through the weeks to make this happen. So really, really proud of you all.
And we're joined by Senator Todd, who herself an educator and one of the most knowledgeable people, I'd probably say the most knowledgeable person in the legislature about education. It'll be a great loss. Of course, she's term limited, but we want to thank her for her work. And I don't think any of us thought we'd ever see a year like this, Senator, but maybe you can give a little perspective on your thoughts.
Absolutely, and I think probably one of the most important things is the flexibility from district to district. The collaboration between parents, community, students, teachers, and really pulling it together with Tri-County Health, particularly in Arapahoe County, is just essential, because that's the win-win. And as Superintendent Siegfried said, you can't bat 100% that everybody's going to be happy. But as I just walked into that classroom and saw the smiles on those children's face, they want to know their teacher. They want to see, they want to feel, even without that touch, that physical touch, they want to know that there is a part of, this is my home away from home, and this is the security and that mental health and that support that they are getting by being present in school in a very safe circumstance. So I'm so appreciative of the flexibility of allowing districts to choose and communities to make those decisions and commitments for what's going to work the most effectively. I feel very good and very encouraged by what we just saw this morning, and know that those children and those families are going to make sure that it's the best possible for them and for their teachers this school year.
And Senator Jeff Bridges is really an up-and-coming leader in education, a champion of early childhood education, of early literacy, really doing an amazing job. Also, both senators represent part of Cherry Creek School District. Senator Bridges, what are your thoughts? You represent this area.
Welcome to District 26.
Yeah, great.
Yeah. So what I've heard, I've talked to a lot of teachers, a lot of parents across the district, and what I've heard is that the process in Cherry Creek was done very well. Teachers were involved from the very beginning. There are a lot of protocols in place to help make sure the kids who are here are safe, and the kids who are learning remotely have the resources they need in order to do that. And I think that is the right model to follow. Not necessarily for what it is that's been decided, but certainly in the process that was gone through in order to get to where we are. And so I have a question for all the folks who are here. As circumstances change, I expect that when the fall hits, there's a chance that the community infection rate will spike. There's a chance it won't as well. That we may have some pods here in schools where some kids get infected. I mean, this is a real possibility. What is the process? What are the steps that will be taken, the conversations that will be had at that point to decide what the next step would be given these changing circumstances?
I think it's a great question for John Douglas to start with, because the guidance from the health center helps all at the state level, the city, at the school district level. John must have a dozen districts. I don't even know, 24 districts. How many do you have? You have a bunch of schools
15
in your area.
Yep.
But you're the early warning. You're the one who would call up the superintendent and say, you know what, we're seeing something, here's some approach. Maybe talk about your approach to how you do that.
Yeah, sure. So I'm probably the only person sitting here who actually expected this could happen, even though I hoped it never would.
That's because it was your job, right?
Exactly. So Senator Bridges, I think your point's really important. It might not, but it probably will. I hope it's not a spike. I hope it's a gradual uptick. I will say that the schools have done an unbelievable job, and it's always sort of a cheap trick to say, oh, this is the best one, but Cherry Creek has really been incredibly thoughtful about how to do this. We've worked with them to develop first some metro guidelines about what it means to be open. Secondly, we've worked with them, really following Scott's lead, on some metrics that we're just about to finalize in the next couple of days that will give schools and the communities and our teachers some understanding. What are we looking at? What are the numbers? We're looking at level of community incidence. We're looking, is it going up or is it going down? It's one thing to be at a high level going down. It's a very different thing to be at a high level going up. Thirdly, we're looking at how adequate our testing is and what the positivity rate is. The governor has been an extraordinary champion for getting testing access. It's absolutely critical to getting our schools open and keeping them open. The schools have got, I think, really thoughtful plans about what to do if things begin to change. realizing nimbleness and agility will continue to be the name of the game. I actually think that a lot of people worry about, are schools opening going to contribute to increased community transmission? And they could, but honestly, I think the safeguards that's been set up, the State Health Department had developed some very thoughtful guidance about what to do if a kid is sick in school, what to do if a teacher's sick in school. I hate to see classes quarantined, but I think it's a smart thing to do. And I think when that happens, frankly, my bigger concern about transmission is going to be kids who are at home. I think schools are probably in some ways a safer place to be than if I'm, in my basement with my 10 best friends because our school is out. And I think all of us as a community will have to be attentive to that. The last thing I guess I want to say is that we don't have a vaccine yet. We're desperately hoping to get one for COVID. But we do have a vaccine for flu. And flu is just around the corner. And all of us need to think about what we can do in our families, our communities, our schools, our recalcitrant friends who won't get a flu vaccine because they're sure it's going to give them the flu, to see if we can get our vaccination rates up, because that will translate into less opportunities for schools to have problems, less opportunities for the community to have problems, and less opportunities for our hospitals to have problems.
I'd love to follow up on that. What I heard you say is that you think the kids who are in schools right now are actually safer than the kids whose families have formed pods elsewhere in the state. I just want to, if you've got a follow up on that.
Pod, Senator, I think you're probably safer, but many families don't have the luxury of having that sort of tight pod. So, as the governor said, some of us, like me, can work from my basement and telework. Those that can't do that may have less opportunities to create that kind of pod for their kids. So I think it all depends on the circumstance, but as I understand how many of our parents who have essential jobs who don't really have that pod seclusion opportunity, I think in general I am concerned about what kids who can't meet in their class may do, and I think parents will have to be vigilant. Sorry, Governor.
Yeah, I mean, like if a second grader wasn't here, where would they be? It might mean they're in a daycare center 3 days a week, they're with grandma 1 day a week, they're with their aunt with 4 other kids a day a week. And so the net exposure of that child might be to many more people, including more adults, than it would be in a socially distant second grade environment. It depends on the family, right? There's others that have a parent at home, the kid's learning from home, they don't go out. But for many families, that's not a reality.
If I may add one thing that we've been able to do here to help protect our teachers as well that was brought up is testing. We are providing ongoing free testing for every Cherry Creek employee. We were fortunate before school started to identify 6 asymptomatic positive tests in adults and keep them out of schools. And so that's out of nearly 5,000 tests that we've run so far. And so it's another of those multiple overlapping safety strategies we put in place to help protect everyone. And that has shown great success already.
And the state will help with that. So our priorities, we are providing masks to everybody in schools, medical grade masks, 1 per week, and they can use any mask they want, but that helps because it's an additional mask. And then secondly, we will partner to provide surge testing around outbreaks to help a school environment that might have an outbreak, everybody get tested quickly and easily. We are reacting to be able to deliver that because you have a good testing program, other districts do too, but we want to make sure we need 600 tests in a 24 or 48 hour period, we're able to do it in a convenient way for parents and faculty.
Thank you.
So I want to just end by thanking our teachers. There's so many people to thank in this. Obviously, first, our front range workers, our nurses, our doctors, but our teachers.
Stand up, second grade.
Stand up, teachers. You really take your ranks among, the nurses, the hospital workers, the doctors. You're on the front lines. You're doing it in a different way, a safer way. I think everybody feels both of those things that I started off talking about. Everybody feels excitement for the kids, for the families. Everybody feels fear and is worried. So it's a whole range of emotion that every teacher and parents too are having, right? I'm a parent. I'm excited my kids are going back, and of course I'm worried a little bit. It's both of those, right? And we all have to reconcile those, and the way that we do that is not by showing fear, but by showing justified caution, right? Caution in how we do things. Wearing masks, washing our hands, keeping that distance. I mean, the way to live in a reasonably safe way, not to give up our lives. I mean, not to just say, and some who are at risk are, of course, totally self-isolating, and that's their prerogative, and they should do that. But for most of us, you want to be there for the kids. I mean, that's why you're teachers, right? And yet you also want to do it in a way where you don't have to be worried about your own life. Just be cautious, be careful. You work with the district, the principal, on the protocols. If you see something that's awry, you let your administrators know and let your union know if there's something that can be done better. But we all know it's so important for the kids. And I just want to thank you, but also teachers across our state. So thank you. And we'll be happy to take a few questions from the media. Yes, if you could introduce who you're from as well.
You mentioned when you first stepped here about giving masks to schools. Is that to all 178 districts?
Yeah.
How many masks? What kind of masks?
Yeah.
And I think you said for 10 days.
And that had been previously announced, but this is the first. Last week was the first week we provided it. So, a mask per teacher per week, and every student-facing member of the faculty. So we asked every superintendent, all 178, what's your number? So if there's a school clerk, school nurse, they're included in the number, and of course teachers. A medical grade mask, identical to the ones that some of us are wearing up here, that I'm wearing, per week, per school. And that's all the teachers in the state, whether they teach private, Catholic school, public school, and they're all getting them, and the first shipment, and even the districts that aren't back in person yet, they're still getting those masks because they're gonna need them when they do go back. Yes.
Obviously, this is an example that seems like it's working really well. We have a lot of districts that have decided not to bring students back. Some of them are in very similar sort of community transition environments. Why do you think other districts don't feel that they can come back?
So I think that the superintendent started early talking with the teachers about the protocols. I think other districts are saying we're going to look at coming back in late September, maybe early October, maybe because those discussions are just not as far along with their county health departments, with their teachers. There's not the comfort level there yet. And they're working on that. I mean, I don't think there's a district in the state that isn't trying to figure this out. They all are. And by the way, Erica, there's also districts that, especially in rural areas, that are back in what you might call a more normal 5-day manner, including their high schools. So it's all over the gamut. But we encourage all of the districts to listen to their public health departments, take the CDPHE guidance very seriously, and have that collaborative communication with their teachers and their parents, their other stakeholders, teachers and parents, to figure how that looks out. But I think that what Cherry Creek did is they started those early. They still were a rush. I mean, I started early, but this still felt like a year's worth of planning in a month period or a month and a half. But I think other districts kind of feel they need that extra month and a half to kind of figure out how it all works in a safe way. Well, I don't want anybody to be surprised in our state when classes and even schools do need to be shut down. That is no different than stores, restaurants, offices. We call it a site-based outbreak. I'll let John Douglas address how they've dealt with site-based outbreaks in different sectors. Schools are part of our society. They're an important part of our society, but they're not some exception to the rule that somehow is immune to what every other part of a society has to have. So the key thing is, by acting early and quickly with the protocols that we've developed with the health professionals, ideally it would be limited to a few people at a classroom level or at a school level. So, if it goes from 1 person to 3 and we act, that's better from quietly going from 1 to 10 to 50 to 186 at a school. And when you have that level, you're very likely to experience loss at that level of infection. So it's about acting quickly and early, and yes, absolutely, that means site-based interventions like classroom quarantines and even school-wide quarantines when it's across several classrooms. John?
I think what has been described recently is exactly what we would have expected, and what happened with quarantines is exactly the right response. Now, I think the proof of the pudding as to whether or not one has ongoing transmission after that. I think that the protocols have been set up right now to be really conservative, to have an early trigger. So I think anybody that was surprised by this honestly hasn't been paying attention to the reality of transmission. And as the governor said, schools are part of our broader community transmission. If we stay low, and we're like 8th from bottom right now in terms of state rates, our schools and other entities benefit. So the more all of us do what we're all doing right here and wearing masks and socially distancing, the better the schools will be able to do.
Really good point that John made. The more we all do better, the more continuity we'll have in our classrooms. The more we all wear masks in public, the more we stay home where we can, avoid large groups, avoid gatherings, keep our distance. The more that we can keep that up, the more continuity the kids will have. So if it's not enough to do it for your own health, if it's not enough to do it for the health of your loved ones, if it's not enough to do it for our economic recovery, which also means to keep it up, do it for the kids, right? Stay safe, safer at home and out and in the great vast outdoors. Be careful because we care about our future. Who else speaks Spanish? Anybody else speak Spanish on this? Okay, I'll take it. Go ahead, todo el mundo. Oh, I was going to give somebody the opportunity, but. Sí. Sí. In K high school? What high school? K high school? Fort Love. Yeah, right. They close for 2 weeks, right? Yeah. So hay uno proceso. Cuando hay algunos casas, ¿cómo se dice? Can you say cases or people? What? Casas? Casos. Cuando hay algunos casos en la misma escuela, sí, esta escuela va a cerrar por 2 semanas para asegurar y limpiar todas las clases y después va a abrir otra vez. En todas partes de sociedad es un poco más peligroso que normal y las escuelas no son la excepción. Y necesitamos tener cuidado en todos que hacemos. Necesitamos usar tapabocas cuando están cerca de otra gente y también no es un tiempo para tener fiestas o grupos grandes. Si tenemos cuidado, podemos regresar al normal más pronto, incluido las escuelas.
¿Cómo encontró esta escuela? ¿Cómo la encontró esta escuela?
Esta escuela es bien, es mi primer visito del año escolar y es muy bien, tengo mucho feliz ver los estudiantes tienen clases y las maestras y la comunidad juntar en una reunión de educación.
Many school districts are doing kind of a combination of in-class learning and online learning. And we learned recently that with COVID in Asia, there's fewer laptops coming over from Asia. And some school districts are seeing a shortage. DPS is one of them. Scrambling to try to make that work this year. I don't know if the state has any role to play or not, but I just want to get your thoughts on that.
And I'll go to the commissioner and the superintendent on that, both. But I would say that when districts need to convert to online, it will be done in a better, more continuous way than last year. Last year was a shock to everybody. And teachers and its principals and superintendents did an amazing job, going to online right away. But of course it was difficult because nobody thought we'd have to do that. There are better preparations this year where if a class needs to go online, a school needs to go online, an area of the state needs to go online, they're ready to do that in a better way, including the access piece. And I'll just say briefly on the access piece, and this is something we even encouraged last time, even in an environment where the schools like DPS, which is not open yet, their school sites are being able to be used as access points for students who don't have that at home, and that's very important. Because if they're able to spread out and have 1 or 2 kids per classroom, proctored without teachers in, there's ways that you can do that for families that don't have that access at home or have no ability because they're a single parent who works to be home with their child. And the school sites have a very important role in that. And even the school districts that haven't gone back, like DPS, are being very thoughtful about trying to accommodate those parents who don't have other alternatives and the kids who don't have access from home. Superintendent? Commissioner?
Yeah. Yeah, we certainly are hearing, our districts have done an amazing job of preparing all summer long and trying to get as many laptops as possible for some of the districts that didn't have complete laptops. I think it is a reality that there are supply chain issues. I meet with my colleagues across the country, and all states are seeing a supply chain issue with all of the laptops that every single district across our country has tried to purchase. So, it's one of those things that we've all talked about. We have to be nimble, we have to be flexible. If we don't get them, then we figure out different ways to be remote or bring smaller groups of kids in to do in-person learning. And our superintendents and our educators and our principals have been amazing at rolling with those punches, and we hope that those laptops are coming in soon.
Thank you, exactly. So we've handed out almost all the laptops we have in the building, and we early ordered about 17,000 additional laptops. They're due in the end of August because our board committed that every single free and reduced student in Cherry Creek would have a laptop before we go remote and high-speed internet. It's critical, and that's a commitment our Board of Education made.
That's wonderful. And I just want Dr. Douglas, were you going to say something?
No, my son was speaking.
Okay. So, thank you to everybody. Thank you to Senator Todd and to Senator Bridges. We haven't given the principal enough time to talk here. Why don't we? This is your school. This is your school, Mia. I know, just like with the teachers, just like with the parents, a whole range of emotion. I'm sure excited to be back, worried about your staff, worried about your teachers, being there for the kids. What parting thoughts would you like to share about this whole experience and kind of the excitement of having your second graders here today?
Well, I'm just so excited to have all of you here today, but I'm also really proud of my second graders and just so excited to have them back in the building. When they were at home, we know that there was some home learning happening, but we know that the most important place for them to be is right here in the building. So they are learning, they are happy, our families are excited to be back. And I feel like with our good guidance and our flexibility to adjust to whatever comes our way has just allowed us to be able to open up and to show other schools that this is possible. This really is possible, and it has gone incredibly well. I think far exceeding the expectations of anybody who thought that we couldn't do it. Yes, we can, and here we are.
It's great.
Thank you for your work. Thank you to our teachers. Thank you to everybody who helped to plan to figure out how to make sure that our future and our children are not a casualty of this pandemic. And it means that, of course, we need to learn, but we need to do it in a different and safer way. And figuring that out and making sure that each community is empowered to figure that out with the teachers, with the administration, with the very best health guidance from our local health agencies and CDPHE. And I just want to congratulate all of you on the collaboration that is really allowing us to continue to move forward even in the midst of the greatest pandemic in a century. So thank you.
Thank you.
Thank you.
Thank you. You betcha. I'll get your bag.